Today's case is about efficiency. Two parasites are made, the staining the capsule was done, and then we're gonna wash the stain with intracameral adrenaline and some lidocaine to achieve three goals: washing the washing the stain, getting some good dilation, and then performing good anesthesia, stabilizing the globe with the Q-tip because this is topical anesthesia, and then creating groove at the limbus, and then creating the main wound with the keratome. And to save time, I didn't use the cystotome, so I'm gonna poke the anterior capsule with the Otarata, and then to save time and being more efficient, so I'm gonna try to do the Rexis 360 in one entry. Making sure that the flap is well controlled and the AC was well formed, and with that you avoid exiting and entering the globe and filling up the AC with viscoelastic, and if you finish your Rexis in one stroke. Now with one entry we're gonna do a hydrosection in all quadrants, and then we're gonna rotate it with the cannula tip, and that also save us more time. And then we're gonna go with the phaco tip, and then stabilizing the globe with the chopper is introduced to the nucleus matter, and then few throws in the middle to create a stop and chop technique. But then while doing so, I was trying to crack this nucleus, adjusting the microscope a little bit, and then I figured that it's too soft and too mushy, and I started rotating it to get some crack somewhere else. It didn't work, so I said, you know what, just like let's switch to phaco 2 mode, flipping the phaco tip, and then we're gonna debulk a little bit, and then we're gonna flip the nucleus to the AC, and then we're gonna emulsify it in the anterior chamber as one piece, and without wasting any time. So in my opinion, like after performing a good number of phaco surgeries under local anesthesia, and you become safe surgeon, it is also important that you focus on efficiency as well. So in this case, we are not using local anesthesia, we're not using subtenon, we're not using peribulbar, it's all topical, and then we make sure that we save time and energy, and you don't need like much fluidics running into this AC. It saves the cornea and the globe from complications. So it's best that to become safe and efficient surgeon, and they are equally important in my opinion. But if you are becoming a beginner surgeon, of course, it is always important to focus on safety. So nucleus is removed, and then while we are removing the cortex to save more time and save one more step, we're going to do the polishing while we're removing the cortex. So a lot of epithelial cells here in the anterior capsule, we're going to polish it while we're removing the cortex mechanically and very, very gently, applying minimal vacuum, and then switching hands and also like removing the opposite part. Again, removing the cortex first, peeling it off from the anterior and posterior capsule, and then slowly we're gonna mechanically and gently with a little vacuum, we're gonna clean up the anterior capsule and mop it off. While I am doing so, I'm asking the scrub nurse to have the IOL ready. That also saves you time, and if the scrub nurse is efficient, she will be preparing the IOL while you are filling the AC and the bag with viscoelastic, lubricating the main wound with viscot. Now I know that the IOL is ready, and the nurse is handing it to me, and with that, without even dilating the wound, we're going to support the globe with the choker, and then we're going to inject the IOL, and we are going to make sure that it opens inside the bag, and the haptics are tucked inside under the anterior capsule rexus. A little extra centration with the chopper won't harm, and then we will remove the viscoelastic, and we'll make sure to form the AC and hydrate the wounds well. So efficiency is important as well. You may you at some point you will be asked to become efficient surgeon, and you will have a lot of surgeries, and especially if you move to private, spending a lot of time with each case is not acceptable. Again, you have to be safe surgeon first. Only then you can move to becoming efficient. Here I'm asking the patient to look down to get a better access to the paracentesis, so I can hydrate them well. Look to the side so I can hydrate the main wound. Look down to the side, look to hydrate the other lip. Thank you so much for watching this case, and have a great day.